Every year on February 4th, the world comes together to mark World Cancer Day. In 2025, Uganda joins the global community under the theme, United in Goals, Unique in Our Needs. A call for collective action while recognizing the unique cancer challenges we face.
The burden of NCDs is very high, starting with the cancers, and specifically talking about cancer of the cervix. We are experiencing an extreme burden whereby Uganda ranks the sixth or seventh among the high burden countries in the world. You find that for every 100,000 women, there are 56 women who present with the cancer of the cervix every year. And unfortunately, out of these, 41 of them die because of late presentation, late screening, and other factors. You also realize that the burden of other NCDs, such as hypertension and diabetes, are also extremely high. It is surprising to note that out of every 100 people, 24 of them have hypertension. And for diabetes, out of every 100, 3 of them have diabetes. These may sound like they are small numbers, but when you apply them on our adult populations, they are really very, very high.
Five years ago, we had around 500 new cancer patients. But when we came to last year, that is 2024, we had around 1,400 new cancer patients. Overall, number one cancer in the region is the cancer of the cervix, followed by the cancer of the prostate, then followed by the cancer of the breast, and followed by the cancer of esophagus, cancer of the stomach, and other cancer follows. We've been blessed that we got a partner who has been helping us to scale up the screening of cervical cancer. These partners who came from Korea, over the year, and also they have increased the number of patients that we screen for cervical cancer. At the same time, treating the premalignant lesions. So we get quite a number of patients whose lesions are actually being treated at the gynae unit at the Mbalala Regional Cancer Center. Now these ladies also get another service of also being screened for breast cancer. We hope down the road this will reduce the number of patients who are presenting with advanced breast and cervical cancer, together with other measures that are being put in place to combat the increase of these cancers.
Generally, about 20 to 25 women are coming in the clinic for screening, and of those who come in daily for screening, we get about 1 to 2 confirmed cancer cases. So averagely, in a week, we get 7 to 10 patients who have confirmed cancer. And we confirm cancer by picking a tissue which is sent to the pathology lab and which confirms the presence of cancer cells. And for those who come with precancer changes, it's about 5 to 10%, and those are able to be treated and followed up within the clinic.
I started to realize that that breast was growing smaller, and then it had a dimpling below. So that's when I felt like it was something serious, and I asked a friend of mine who was a doctor. So she asked me to go to another government facility, and I was asked to do a mammogram. I did a mammogram. It was highly suspicious of breast cancer. So I was asked to do a fine needle aspiration biopsy. Even that was highly suspicious, but not conclusive. After like a few months, I started to have backaches. So I did a CT scan and it showed the cancer had moved to the spine. Yes, so I treated that. Then I started to have difficulties breathing. And then I did another CT scan, and the doctors again found out it had moved to the lung, the left lung. So the lung had tumors and I had a fluid in the lungs.
Kwagana funa urine nga tejja bulungi. Kati nenzijjanjabwako, kati ate ne bagamba nti wali e Masaka tuwali Cancer Gundi Institute ne bansindika eno embalala. Kati obujjanjabi mbadde mbusanze nga si bubi era mbadde ninawo enjawulo. Engeri luli gye nali sifuuyisa bulungi kati nfuuyisa naye nga baŋŋambye ntala nyinkire bunyinkiziko kwe gabo baagala kulabira ddala nga.
Nasooka kulwala amagulu n'enzimba nga sikirabangako ebigere. Bwe byava awo ennaku 3 ne bituuka mu ntumbwe n'ebisambi, n'enzimba n'obuluuto n'ekifuba. Kati bwe nalwalwa ne neebaka owaka, ne ndaba obulwadde obwo nga sibutegeera bulungi. Nina omwana omuvubuka eyajja nannona nandeeta emulago bankwata ebifaananyi. Kati baddokita baakebera awo nali nazimba nnyo nga ndi mu ssaawa yakufa. Ne bakola examining ku bulamu bwange ne balaba oba nalwala mutima oba kibumba oba nsigo, wamu yagamba nga prostate. Dokita oyo okuku yankebera, musajja mukulu, naŋŋumya naŋŋamba nze ndi dokita nzijanjaba abantu, guma musajja gwe togenda kufa. Naŋŋamba obulwadde bubadde bwakakukwata ogenda kuwona. Ne mugamba nze mpona ati ye. Era olunaku lwe najja ne mulaba, olwaleero lwe nzizemu ne mulaba, Ssebo Pulezidenti w'eggwanga weebale nnyo n'obuyambi bwe watuwa, emulago gyo nabufunye. Naye nkwebaza Pulezidenti obulwadde nze nawonya obulwadde, prostate yazimbulukuka siri kyalina kinnuma. Pulezidenti weebale nnyo, weebalire ddala. Abantu baweereza amawulire amakyamu nti abasawo tebajjanjaba emulago. Ssebo abasawo bo bwe watuwa bajjanjaba kiro misana.
Our partnership with Uganda began with a shared commitment to improving healthcare accessibility and quality, recognizing the growing burden of cancer and the need for improved screening and early detection. We saw an opportunity to make a meaningful impact. Working closely with the Ministry of Health and the Uganda Cancer Institute, we launched a 3-year with $3 million pilot project focused on cancer prevention, screening and treatment. So our goal is to reduce the cancer mortality rate by improving early detection and strengthening Uganda's capacity to manage cancer crisis. So our efforts focus on early detection and accessibility. We have established mobile screening units to reach the communities, ensuring that women can access free cervical cancer screening services. And also, we have trained the local healthcare providers to enhance the early detection capabilities within existing healthcare facilities, such as Health Center 3 and 4. By integrating technology and innovative solutions, we are making cancer screening more efficient and accessible, ensuring that people receive the care they need as early as possible.
National Cancer Management and Capacity Building Project for Uganda. Because cervical cancer is the most challenging issue at the moment in terms of mortality. So the project aims to reduce cancer incidence by providing screening interventions at different levels of health care. We selected 20 facilities. In these health facilities, we selected a team of 2 nurses in each health facility. These are nurses or midwives. We selected 1 laboratory technician. We selected the health information assistant, which we call a data person, who manages data at the facility. We also selected doctors in facilities that have doctors. We all know that health center 4s have doctors, but health center 3s are managed by clinic officers and nurses. So the intention here is actually to train a doctor at health center 4 to understand interventions handling referred cases from health center 3.
For the time being, the project has been running. It started in 2023. It's a 3-year project. I believe that it has been able, or we have started to see some of its benefits, and we are trying to realize the objectives. For example, one of the objectives is to create awareness among the Uganda population in the different communities about cancer, about its prevention, services offered, and the treatment. So I believe this message is being brought across slowly by slowly.
We are glad we have been getting support from Uganda Cancer Institute and the Korea International Health Foundation. They have been giving us support, and we have been screening, especially cancer of the cervix. A good number of health workers were trained on screening for cancer of the cervix, and we have been screening. In fact, we have a cancer screening clinic in our facility, and we also have an HPV DNA machine in our lab, which tests for the HPV DNA.
Most of these cancers, once captured early, they are treatable and they cure. The challenge we usually get is you coming to us late.
Depending on your age and then your gender, we need to screen for the common type of cancers regularly as recommended by the health workers. For example, when you're a woman, we encourage you and recommend you screen for cancer of the cervix and cancer of the breast, because those are the 2 common types of cancer affecting our women in Uganda. And for the men, one of the most common types of cancer which you can screen for is cancer of the prostate. So when you're a man 40 years and above, you start screening yourself once a year for cancer of the prostate, which is the most common type of cancer.
Those who are going through the same journey that I'm going through, I want them to know that there is hope. Because when it comes to breast cancer, it's one of the most treatable cancers as long as it's detected early. And then for ladies who are scared to screen, for those ladies who think it's better not to know, it's really will not help. Because at the end of the day, if the problem is there, you're just waiting for it to explode. And yet if you go early, they might catch it before it turns cancerous, or when it has just started, and your chances of surviving are very high when it's caught early. Or if it's caught before it turns cancerous, then you can get the treatment you need, and it will be very simple treatment, other than waiting for it to become bad and then you have to take a whole year plus to treat a disease.
Nze ndi musawo wa kinnansi anjagala nnyo abantu babeere abalamu. Kati nakimanya nti obwo obulwadde sisobola bujjanjaba nenzija mu ddwaliro. Nsaba abantu mwenna n'abasawo mwenna ab'ekinnansi abajjanjaba abantu, bwe mulaba abantu ng'obulwadde temubasobola mubuleke, kuba nze nandifudde seegeziwaza ku ddagala. Nakimanya nti obulwadde sijja busobola, si bwange, saabusomerera. Kati mulaba mponye munnammwe munfuule ekyokulabirako mu ggwanga. Singa nange nagamba kanywe eryange nandifudde.
So we need to do a lot as far as ensuring that we are screened early for the different cancers and for the other non-communicable diseases, if we are to be on the top of these conditions. Otherwise, waiting to present with an NCD, the treatment route is very complicated, very costly, and very catastrophic, the outcomes are usually very disastrous, economically and for our lives.
My last wish that this funding which the Korean have extended to us is scaled up to other districts, and it continues. We believe that several years down the road, we shall see a big impact when probably women no longer be dying of advanced cervical cancer. That is where somebody says, we hope to end cancer in your lifetime. And for cervical cancer, it is possible because countries like Australia, which intensified immunization of young girls against HPV, and of course, screening regularly, they have totally reduced this burden of cervical cancer in their population.
Cancer is preventable and treatable, especially when detected early. We encourage all Ugandans, especially women, to take advantage of these free cancer screening services provided through this project. At COFI, we believe that everyone deserves access to quality health care. So together, we can fight cancer and ensure a healthier future for Uganda.
Patients have been old like 80, 90, 60, that range. And those of 40, they were a few, but mostly 80 to 90 years.
Wenkanye ndine kitu kusasa mabere nani ndakwehurira je ningerwa mutuma ngakaya kubanjebera basanga amabere ganje gatari mukansa kandi basanga pressure yanje nayo nyinshi isimo uhereze mwizo mwanya nchebera siba nchebera mbonu kubajenguna nona yabagambira nkoku nagweire nte 2019 bakanshemeza mbarara kubanshemeza nangwa abantu amakapira nkokwezi kumwe bakiyamu hati yakuna amayenka mezi nko mwaka mbwenu natandika kushasha nkiza kushesha nshasha munenga mbwenu hati yoshaka mundu mu ecweke kinebironda mpaka nandashoze nka babasha ngo yaba mu nakezi
bani wanonda eji program abakora bakuyambe bat
banyambe bampeme imibazi nake ndebe natuzi
nayisha kuchereza kongatayire program ndizo nyine tikushasha tikuja konga kumpurira mundu bachereza nanye nagu ndebe status yanje ko babe yine byo kunchebera ngenda banyambe aho kuba nejaha banchebera banchebera pressure bashangiria yiguru banchebera sukari bashangiria hasi nomo
ngero buzanza biterezo buzanza bwamani aha cyaro nicyo twabaje tureka kufa munonga.
It's important for people to come and check for their bodies because it can help you to know your health and overcome some diseases, overcome death rates at an early age. Because if you know your health, you can be given medicine and worked upon.
I'm truly inspired by efforts of the Ministry of Health, Uganda Cancer Institute, and our partners in non-communicable diseases, who have worked tirelessly in raising awareness and providing vital screening services across the region. As we gather here today, we reflect on the crucial role health screenings that have taken place since the 1st of January, culminating to this commemoration of this day. These screenings are more than just a diagnostic tool. They present a lifeline for early detection, timely treatment, and ultimately saving lives. Today, we gather not only to raise awareness about cancer, but also acknowledge the urgency of addressing this growing challenge. For example, in Mbarara, in 2024, we registered 1,400 cases of cancer. 742 were men and 658 were women. Prostate cancer and stomach cancer are the leading types affecting men, while cervical and breast cancer remain the most prevalent among women. These numbers are a stark reminder of the pressing need to do more in the fight against cancer.
So according to this exercise, a lot of work has been done, and we thank the UCI Marago together with South Korean, who are IPs as of now, for the great work they are showing to us. Because a lot of Ugandans have been suffering because of cervical cancer, prostate cancer. As a head of records, we have been having a great number of clients who have been suffering from these conditions. As I talk now, in our statistics, Wiswere Center 4 has managed to screen 1,500 clients due to cervical cancer. And from this exercise, we have screened 1,200 clients. Coffee, as an implementing partner, continue giving hand so that our Ugandans can benefit from their services.
First of all, public health care works. Primary health care works and public health works. That is one thing. The second thing that this experience has taught us is that we need money. Of course, we shall get funders who are very good, like our Korean friends, and I want to thank you for your generosity. But it will not be too much. Probably they will fund 2 districts, and that is it, maybe even 5.
You can imagine abarwire emitwaro 25 ba cancer. Emibazi no byakuba ningana ki nehwaho. The only thing I think Dr. Kamara is here, my colleague, ntwisha kugira ngo bongere Cancer Institute budget. Kugira ngo tubine sente, konke sente abarwire nibazikira. The only solution no kubongere sente.
But let us not forget that the fight against cancer extends beyond health care. It requires that we all come together as government, as individuals, as communities to address the risk factors I've mentioned. We need to promote early detection because once cancer is detected early, it is curable.
Is brought to you by the Uganda Cancer Institute and the Ministry of Health in partnership with Kofi. Together, we are united in goals, unique in our needs.